Assalamu alaikum. Now I would like to talk about the parathyroid gland disorders. In here, I will discuss the usmle inner circle nodes and start with my intro, where you will hear a heart sound, or where you will hear a sound. Can you tell me the name of this sound? Okay. Okay. Parathyroid gland. Okay. Before jumping into these, first of all, I would like to discuss about the hyperthyroidism. Okay, in hyperthyroidism, what tests help localize the involved gland in hyperthyroidism? Ultrasound and nuclear imaging, 99M technetium systematic scan below are most used. So for localization of the pathology of the hyperthyroidism, you will do ultrasound and nuclear imaging, 99M technetium systematic scan are mostly used. Okay, and in here, treatment of chronic hypoparathyroidism, that means with low calcium and vitamin D, but calcium and phosphorus level must be closely monitored. A calcium phosphorus product, serum calcium into serum phosphorus, if it is more than 55, increases the risk of soft tissue calcification. Calcification in the basal ganglia can cause extrapyramidal manifestation. IL word like calcification in the basal ganglia can cause extrapyramidal manifestation. And calcium phosphorus product like serum calcium into phosphorus, if it is more than 55, increases the risk of soft tissue calcification. Okay, primary hyperparathyroidism etiology is primary parathyroid adenoma. Most common is parathyroid adenoma. It may be hyperplasia carcinoma and increase the risk of MEN1 and MEN2A. MEN1 is pituitary pancreas parathyroid. MEN2A is parathyroid thyroid pheochromocytoma, and 2B is thyroid pheochromocytoma and mucosal neuroma. Symptoms Symptoms may be asymptomatic. There may be a mild, non-specific symptom like fatigue, constipation, abdominal pain, renal stone, bone pain, neuropsychiatric symptom. Diagnostic finding: calcium is high. There may be elevated PTH, elevated or inappropriately normal PTH. So calcium high, PTH is high, and 24-hour urinary calcium excretion is high too. Calcium excretion is high too. Where we will do parathyroidectomy if age is less than 50, if there is symptomatic hypercalcemia like bones and stones and psychotic overtones. Okay, and complication like if there is osteoporosis, if the T score is less than 2.5, fragility fracture, nephrolithiasis or calcinosis, CKD, GFR is less than 60 ml per minute. If these complication is present, do parathyroidectomy. If elevated risk of complication like calcium is more than 1 milligram above normal, urinary calcium excretion is more than 400 milligram per day, then you should do parathyroidectomy. So age less than 50, symptomatic hypercalcemia, complication like osteoporosis, and elevated risk of complications. What is the likely diagnosis in patients with serum elevated serum PTH calcium, and normal urine calcium and creatinine ratio? Primary hyperparathyroidism, normal calcium or by creatinine clearance ratio. If it is more than 2, then it is problematic. If it is normal urine calcium creatinine ratio with elevated PTH calcium clearance ratio. So elevated PTH by calcium clearance and normal calcium by creatinine clearance. It is hyperthyroidism. Differential from familial hypocalciuric hypercalcemia, where there is increase urine calcium excretion. If there is increased urine calcium excretion more than 0.2, it is familial hypocalciuric hypercalcemia. So newborn boy presents with 3 days after delivery with tachypnea, tachycardia, spasm, seizure. Lab shows low PTH, low PTH, low calcium. The remainder of the examination are normal. Most likely diagnosis maternal familial hypocalciuric hypercalcemia. Asymptomatic, so may go undiagnosed, and maternal hypercalcemia causes hypercalcemia in the fetus. Maternal hypercalcemia causes hypercalcemia in fetus and suppression of the parathyroid gland. After a delivery, fetus with hypoparathyroidism with hypocalcemia. Differential diagnosis is D. George. Will have catch feature, conotruncal abnormality, abnormal faces, hypocalcemia. There, there may be hypocalcemia, um, absent hypocalcemia. These are the catch feature for D. George syndrome. So, for familial hypocalciuric hypercalcemia, low PTH, low calcium. In a newborn, low PTH, low calcium. Okay. In patients with long-standing CKD with end-stage renal disease, chronic parathyroid stimulation can lead to parathyroid hyperplasia. This is associated with autonomous PTH secretion, not suppressed. Autonomous PTH secretion not suppressed by rising calcium. It is not suppressed by rising calcium. Okay, not suppressed by rising calcium due to down regulation of the calcium sensing receptor and vitamin D receptor in the parathyroid gland. Due to down regulation of the calcium sensing receptor and vitamin D receptor in the parathyroid gland, the net effect is termed as tertiary hyperparathyroidism. Extremely high PTH level, hypercalcemia and hyperphosphatemia. Extremely high PTH level, hypercalcemia and hyperphosphatemia. Extremely high PTH level hypercalcemia due to mobilization from the bone and hyperphosphatemia due to renal phosphate retention. Hyperphosphatemia due to renal phosphate retention. Indication of parathyroid is parathyroidectomy in tertiary hyperparathyroidism. If persistently elevated calcium more than 10.5 milligram per dl, phosphorus and PTH is more than 800, soft tissue calcification, calciphylaxis, vascular calcification with skin necrosis and intractable bone pain and pruritus. Parathyroidectomy is recommended for patients with primary hyperparathyroidism who have symptomatic hypercalcemia complications like osteoporosis, nephrolithiasis, CKD. So parathyroidectomy should be done. Symptomatic hypercalcemia complications and increased risk of complication, moderate or severe hypercalcemia. In addition, patients aged less than 50 are likely to develop complications later in life and should undergo parathyroidectomy. So in this topic, the indication of the parathyroidectomy is a very important. If there is osteoporosis, nephrolithiasis, CKD, and then we should do parathyroidectomy. If there is symptomatic hypercalcemia, they do parathyroidectomy. Okay, that's all for parathyroid glands. Um, can you tell me the heart sound or the sound? It is carotid bruit. Hope you enjoyed.